myself, Dr. Soomashree Manna, first year physics. Medicines remain one of the most important tools in healthcare delivery. Medicine reconciliation is the process of ensuring that a hospital patient's medicine list is as up to date as possible.
Dr. Manna, you are muted.
Am I audible, ma'am?
Yeah.
Medicine reconciliation is done to avoid medication error and to achieve optimal therapeutic benefit and save patient care. The case scenario was a 55-year-old male diabetic hypertensive patient was referred from medicine OPD to a therapeutic clinic with complaining of fever, dysuria, right-sided diabetic foot ulcer, and bipedal edema. He was on more than 5 medication, namely vildagliptin, metformin, glimepiride, amlodipine, amoxicillin, levofloxacin, and alkazol. Investigation picture revealed that poor control of blood sugar and albuminuria and mixture of UTI. We recommended firstly insulin injection glargine 12 unit and dose reduction of metformin from 1500 mg to 1000 mg per day for better glycemic control and thereby prevent recurrent UTI, which is the one of the cause of recurrent UTI. Secondly, tablet telmisartan and clothalidone instead of tablet amlodipine. Telmisartan is an angiotensin receptor blocker, but also it has action of PPAR gamma receptor partial agonistic property. So by activating PPAR gamma receptor, it causes insulin sensitization and prevent glucose intolerance, and it also has action of anti-inflammation and antioxidant action. So it helps by lowering blood pressure as well as prevent incidence of diabetic nephropathy by inhibiting incidence of albuminuria, and it also preventing progression of in renal interstitial inflammation, glomerulosclerosis, and fibrosis. And the clothalidone, by inhibiting sodium chloride co-transporter in DCT, it increases sodium concentration in DCT, resulting altered osmotic gradient, so that intravascular water and solute content is decreased. So it helps by lowering blood pressure as well as it subsided bipedal edema. Thirdly, instead of both dual antibiotic, levofloxacin and amoxicillin, which were prescribed for diabetic foot ulcer and urinary tract infection, we recommended only one antibiotic, tablet linezolid, which covers both foot ulcer and UTI. And lastly, we recommended omission of syrup alkazol as it may cause electrolyte imbalance, mainly hypernatremia in background of diabetic kidney disease. As diabetes itself is associated with both hypo and hypernatremia as well as chronic hyperkalemia, alcohol may hasten the associated morbidity and mortality. We also suggested routine blood investigation like APS, PPBS, urea, creatinine, electrolyte, lipid profile, urine ACR, and also USC of lower abdomen to rule out BSP as it may cause recurrent UTI. And on follow-up after 1 month, patient's compliance was better. PP and
Sum up, time up.
So I want to conclude that medicine reconciliation is a cost-effective use of the health dollar and safe patient care in any environment. Thank you, sir.